I've reached Kim at Complete Balance. Today I wanted to take you through a self-massage technique for tight calves. I mentioned tight calves, but actually we're looking at a muscle that runs all the way down the back of the leg, attaches into the heel and also to the tibular and fibular heads at the back of the calf. This particular tight muscle can give you symptoms of plantar fasciitis, it can give you painful calves, but it also can give you lateral hip pain, so pain on the outside of the thigh. I'm seeing more and more clients coming through the treatment doors with this kind of tension, partly because I think people are going out walking a lot more, and they wouldn't necessarily associate going for a walk along the beach or over the downs as a need to do some stretching. So I really would advocate, if you're going out for a walk that's going to last more than 30 to 40 minutes, really do think about giving this a whirl. So we're going to take 2 tennis balls and you're putting them into a sports sock, tying a knot, keeping the balls nice and close, so you've got a sort of natural dip there. I've got a block. You don't need a block, it's only really to lift my leg up so it's in camera view, but it does help sometimes to keep the leg off the floor. I'm going to take the 2 balls and I'm taking it all the way down to the heel. And I'm just doing a little bending of the knees, not a big bend, just a general frictioning of that area. The intention is to try and melt the fibres and melt the connective tissue. So this is particularly working on the Achilles tendon, but you will be targeting the soleus as well. Muscles do not work in isolation, so they tend to work as a group. So by targeting one, you will always affect others. And then you're going to take the ball a little bit higher up, and the same action, just taking it up and down, up and down. You can see that I've got the toes pointed towards the ceiling, just puts it under a little bit of stress. If doing it this way is too uncomfortable, too painful, then the other option is to point and flex, to point and flex. And the muscle that we're working on, the soleus, allows us to point. So you'll notice when you draw the toes up towards the chest, the muscle shortens, you'll feel restriction at the back of the leg, and then when you point, it lengthens. So that's another way of doing the same target. So if you haven't got the mobility, or it's too painful to do this frictioning, this rolling, then you keep the ball as it is and just point and flex. Or you can do both. There's no right or wrong way of doing this. So I'm going to take the ball all the way up. If you find a sore spot, it can be nice just to hold, work into that area for about 30 to 40 seconds. Never exceed 6 out of 10 in pain. If you've got any deep vein thrombosis, then I don't recommend you completing this exercise, or if you've got varicose veins, I wouldn't recommend you complete this exercise. Good. So now we're going to take the ball right up behind the back of the, so the line is, if I follow the base of the patella round, it's behind there. So we're not into the actual back of the knee itself, just below it. And we're just going to do a little bit of frictioning in through there. Then the next thing I'd like to do is to try and target the outside edge of this soleus. And as I'm doing that, I'm affecting other muscles such as the tibularis anterior. I'm still affecting the Achilles. So you can see here, I've turned the foot, so the inside of my foot is pointing up towards the ceiling and the knee is coming to the same side shoulder. And again, just frictioning. Or you can keep the ball still, point and flex, same kind of principle. All the way through, coming all the way up towards the knee. Again, finding a sore spot, and then you might want to just rest the balls there, wait and hold, and you're allowing for the tissue to melt, to soften. Good, and then we're going to do the other side. So we've done the outside, we're now going to do the inside. Now I'm, for the purposes of the video, racing through this a little bit quick. So I would suggest that you take time, be comfortable. I'm sitting on a blanket and I'm leaning up against the wall. So I'm not using my back muscles. I've got my hands on the floor really for stability, but I'm not pushing through. You can see now that my toes are pointing away from me and the knee is kind of coming up towards the opposite shoulder. Good. And I just keep moving the ball. You can, use the whole body to lever, but that would potentially cause some issues with the shoulders. So unless you're feeling particularly strong in the shoulders, I wouldn't suggest you do that this way. Nice and patient, just easing out the tension, coming all the way up, it's back towards the knee again. It's nice to work from the ankle up. There isn't really scientific reason for going this way. There are a few people would suggest it's always better to work up towards the heart. In treatment room, I might do it slightly differently because we'll have undergone a few health checks and I'm aware that it's safe to go in both directions. So again, if you find somewhere that's particularly tender, you just sort of wait and hold, allow the tissue to soften around the balls. So this is working on the connective tissue. And because we've got connective tissue, as it sounds, runs completely through the body. You might be working on the muscles, but because you're working on the connective tissue, you will feel changes perhaps at the front of the thigh, maybe into the plantar fascia. If you want to add a little bit of pressure, you can cross one leg over the other and you can point and flex if that feels okay. You could just go to where you know it's particularly sore, maybe it's sore there and you can use a little bit of weight there. It's a lot more pressure, so be careful not to exceed 6 out of 10 in pain. You can bring a little bit of movement to it. This kind of targeted work is called trigger point therapy, so you're focusing on the knots and allowing the knots to melt, to ease, to release, to let go. We're not drilling for oil, you're not trying to dig into it, hence the movement. And I'm moving my foot, so you can see I'm pointing the toes, drawing the toes to the chest. Good. So you can do the outside edge, the inside edge, the back of the leg, a couple of tennis balls and a sock. You can take a few minutes, something to do in front of the TV. But this will help relieve knee pain, plantar fasciitis, lateral hip pain, and potentially also release the hamstrings, and particularly if you get any pain into the ischium, the sit bones. If you've got any questions, drop me an email at info@completebalance.co.uk.